Now, we're going to talk about adverse effects of indoor air pollution. The acute effect includes irritation of the mucus, and cough, wheeze, or chest tightness, and also increase your response to the allergen. And the chronic effects include decreases of the lung cavity, and also impairment of the pulmonary function, and also susceptibility to the chronic obstructive lung disease or COPD. The combustion of low-quality coal with high fluoride happens in the mountainous areas in China, and this causes a higher concentration of fluorine in indoor air and in storage food, which can cause dental fluorosis and osteosclerosis. The combustion of low-quality coal with high arsenic can cause arsenic poisoning, which can lead to arsenic melanosis or hyperkeratosis or skin cancer. This is hyperkeratosis. Benzoylpyrene or BAP usually exists in complex PAH or polycyclic aromatic hydrocarbons mixtures of all sources. It's highly carcinogenic. Tobacco tar contains more than 500 kinds of PAHs, and some of which are strongly carcinogenic. Carcinogens in tobacco and cigarette smoke include arsenic, nickel, chromium, cadmium, lead, and benzoylpyrene. Now they can all cause cancer in animals. Cigarette smoking is the leading cause of lung cancer worldwide. The risk of getting cancer is 2.24 times higher if you smoke than if you don't smoke. It can also cause cardiovascular disease and COPD. Passive smoking measures the flow generated by the incomplete combustion of the smoke compared with mainstream smoke. A survey found that if a family member is a smoker, the cancer risk for the rest of the members increased by 1.4 times. If within the family 2 members are smokers, then the risk increased to 2.3 times. If there are 3 or more smokers, the risk of cancer increased by 2.8 times. We have talked about radon. When radon is inhaled and deposited in the lung, since it's radioactive, it can damage lung tissues and possibly cause lung cancer. But since this takes a long time, so there's no immediate symptoms. Radon is a radioactive gas that emits alpha rays. The combined effect of radon plus smoking is exponential. These are the number of lung cancer cases per 1,000 people. And you can see that with the same amount of radon exposure, the risk of smoker getting lung cancer is much higher than non-smoker. There may be no specific reason for sick building syndrome. The problem includes irritation to the eyes, nose, and throat, and headache, tiredness or fatigue, and difficulty in concentration. It's a building-related illness. The characteristics of sick building syndrome includes fast onset, and the number of patients could be very high, and then the cause may be difficult to identify or recognize. And generally, after you leave the contaminated building, the symptoms will go away. Depending on the source, it can come from bacteria, which will cause Legionnaire's disease, or dust mite, which can cause asthma, and radon, which can cause lung cancer. The biological air pollution includes pollen and dust mite. Pollen can cause pollen disease, asthma, and rhinitis, and dust mite can also cause the same thing. Dust mite have a strong allergen immunogenicity. Allergens not only exist in the dust mite itself, but can also come from excretions of dust mites. So about 1 in 20 or 5% of the people have asthma. We're also going to talk about noise. Noise can cause hearing impairment and hearing loss. It can also cause annoyance and sleep disturbance and stress. It can also affect our performance and our speech. So about 40 decibel of noise is generally okay, but if it's more than 70, this will result in a lack of concentration, upset, and will impact our study and work efficiency. The noise standard is generally around 40 to 50 decibels indoors. Now these are short-term exposure materials such as carbon monoxide, volatile organic compound, formaldehyde, pesticides, and biocontaminants. And the short-term symptoms include irritation of the eyes, ears, nose, and throat, headaches, dizziness, fatigues, watery eyes, and sick building syndrome. Now, the long-term exposure materials are asbestos, silica, lead and mercury, and radon. And the long-term symptoms include respiratory disease, asthma, heart disease, cancer, and poor development, and sick building syndrome. Next, we're going to talk about assessment of indoor air quality. Now, take China's indoor air quality standard for example. The items specified in the standard should not only include chemical pollutions, but should also include physical, biological, and radioactive contaminations. For example, degree, humidity, airflow, and other common items should be included in the standard. These are the commonly used index to evaluate indoor air quality, such as carbon dioxide, carbon monoxide, suspended particles, and sulfur dioxide, and other parameters. Carbon dioxide mainly comes from exhaled gases and fuel combustions, and it can reflect the level of indoor air gases and indoor air ventilation. And it's an important indicator of indoor air pollution. So the carbon dioxide concentration, if it's less than 0.07%, the body feels good. If it's equal to 0.07%, the body may feel discomfort. But if it's more than 0.1%, generally there's a bad odor and people feel uncomfortable. The indoor air quality standard for carbon dioxide is less than 0.1%. Microorganisms and suspended particles can also affect the quality of indoor air. The total bacterial count should be less than 2500 CFU per cubic meter. Other indices for indoor air quality include sulfur dioxide and carbon monoxide, which generally comes from the combustion of fuels. The carbon monoxide is especially important because it can combine with hemoglobin to reduce the oxygen carrying capacity of hemoglobin. Other materials such as formaldehyde and radon we have already talked about. To ensure the cleanliness of indoor air quality, we should have reasonable choice of land for residential areas and reasonable choice of building materials and decoration materials. We should also have good residential plan configuration and residential health scale. And we should have adequate measures to improve air quality and improve personal hygiene. And we should try to prevent the problem of air conditioning disseminated disease and strengthen health promotion, improve health legal system. This comes to residential health protection measures and monitoring. Protective measures should include heat preservation and heat insulation, and something like shade and heating, and also ventilation air exchange. And the materials we use should be reasonable. Don't use something that you know is radioactive or it's harmful to our health. That's it for today. Remember to check out the videos in this class.